Hello, and welcome to Cornell Keynotes. I am your host, Todd Olmstead, and I'm very excited to bring you the 5th Public Health Keynote of 2026, where today we'll be discussing alternative first response programs in the U.S. Joining us are Daut'e Martin and Rebecca Mironko from the Law Enforcement Action Partnership and Gabriela Solis Torres from Harvard Kennedy School's Government Performance Lab. As always, we'll be taking questions from the audience, so please feel free to put them in the chat, and heads up for resources and useful links in the chat as well. Daut'e, Rebecca, and Gabriela, thank you for joining me today.
Thank you for having us.
Thank you.
All right. To begin, could each of you briefly describe your work on alternative first response programs? Daut'e, let's start with you.
Yes. So I contract with cities to design community responder programs, which sends unarmed responders to calls related to nuisance, noise complaints, homelessness, neighbor disputes. And we go through a whole lengthy process of talking to stakeholders, reviewing data to best determine how to make a community responder program possible in that city.
Great, thank you.
I work with Dee on LEAP's community responder team, and I lead our nationwide map of community responder programs, which I will go further into detail on later. And I also lead our community responder police network, which has a bunch of police who have worked in these cities with community responders to act as credible messengers for the programs.
Hi, and so like you mentioned, Todd, I work for an organization called the Government Performance Lab. So we are a research and technical assistance organization that's based out of the Harvard Kennedy School. And my team specifically supports governments in implementing, expanding, and evaluating their alternative response teams. So to date, we've worked with 35 jurisdictions across the country to help them set up these teams. And we also host a monthly community of practice where we convene practitioners to share about what they're testing in regards to this program. So since this is such a new and rapidly iterating field, we really want to host a space for programs to share what they're trying and what they're learning and really spread those learnings across the field. So if there's any practitioners in the audience, you can give us a Google and join us.
Great, thank you. All right, let's get into it. Gabriela, to provide some context for today's conversation, what did a typical first response within the 911 call system look like 5 years ago before these alternative response programs really existed?
Yeah, that's a great question. So 5 years ago, I think in most places in the United States, when a person called 911 for help, they were usually connected to one of three options. So I think that we're all quite familiar with. So we had police, fire, and EMS, so emergency medical services. And the way that would work in practice was if you had a medical emergency, we sent you an ambulance. If you had a fire, we hopefully sent you a fire truck. And for everything else, we sent you a police officer. So the challenge with that is that 911 gets a lot of calls. So the count that we have right now is about 250 million calls a year. And about 30% of those calls, by our estimate at my organization, are calls that could actually be handled without sending an armed response. So those calls are often related to things like mental health crises, substance use, homelessness, welfare checks. And they really are situations that often just need stabilization, de-escalation, and some sort of service connection, more than they actually need enforcement. So if I would describe it historically, there's really been just like a mismatch between the calls coming into 911 and then the teams that the system had to respond to them.
Great, thank you. Daut'e, given the limitations of traditional first response models, what are the goals of alternative response programs?
Great question. As Gabriela just mentioned, oftentimes police officers are really the default to many 911 calls, and many people have started to notice that many of these calls do not involve crime or weapons, and another responder would be better suited to handle the call. So we call it ensuring the right responder, is one of the goals of alternative response programs as well as community responder programs, and really matching up the skills needed with the call as well. I would say another goal of this program or these programs is to really reduce harmful interactions between law enforcement and community community members. With many marginalized communities, a badge, a gun, a siren could really exacerbate a situation. So that is another goal of this program. I think another goal of this program, I think people don't realize that the crisis does not end once someone like a law enforcement officer or fire EMS responds to the call. That crisis is continual. And so with community responders as well as different other alternative responder programs, they're able to actually provide resources and follow up and spend more time on those calls versus going from call to call and not being able to really get to the root causes of problems. So these programs are definitely improving social and clinical outcomes because responders have more time to sit and understand what people are actually experiencing in their crises instead of just responding and going to the next call.
Thank you, Daut'e. We actually have our first question from the viewers. This is a question from Preston for Gabriela. Gabriela, you mentioned that 30% of calls to 911 call system don't need an armed response. Could you say a little bit more about where that number came from, how you got to that number?
Yeah, so we've actually done, from working with a few jurisdictions now, have looked into their local 911 call center data and have pulled out just metrics on what is it actually that's going on in the field on these calls. So one specific jurisdiction that we looked into was Durham's. So I'll use this example later, so helpful to really get into the weeds with them. But essentially, calls right now are getting screened for eligibility. So is this a call that has weapons or violence on scene? And the way that call taking protocols work is that you can sort of see what is going on scene depending on how people are giving information to these call takers. So when you look into that process, you can pull out and see what are the calls where there are violence, there are weapons, there's some criminality, and then deduce about how many calls could be diverted to one of these teams. I know LEAP has some resources on this, and also our colleagues at the Vera Institute, so we're happy to share those resources too after.
Yeah, I would actually like to add to that. What Gabriela is referring to is the call notes. So everything that someone says is typed and written down by the call taker. And what we do is we are able to look at that call narrative to really understand what's happening within the calls. With doing this work, I have really learned how the call type name oftentimes does not match what is actually happening during the call or during the crisis. Atlanta used to have a call type titled Fight in Progress. But when you actually look at the notes, it usually does not have or involve a fight in progress. It's sometimes like a verbal dispute or like, hey, my child is refusing to go to school. So when you're able to actually take a look at the call narrative, you're able to see, okay, what is happening in those calls? Is it weapons? Is it violence? Is someone having a mental health emergency or a medical emergency? So like she said, we're able to deduce that and understand whether these calls would be better suited by a community responder or by law enforcement, fire, or EMS.
Great, thank you very much. Gabriela, now that our listeners have a better feel for the context and motivation underlying alternative response programs, can you describe how the programs actually work in practice?
Yeah, so in practice, I think you can imagine alternative response as being almost like a new lane or a new branch of the emergency 911 system. So in the real world, like workflow, the way that this happens, and we were kind of getting into this in this last answer, was that a call comes into 911, a 911 call taker will then screen the call for eligibility and risk, and then either decide who to send. So they can send a traditional responder, an alternative responder, or a combination of both, depending on what's going on in the call. And there are really three major models that are used today that we kind of see over and over again. So the first is an embedded clinician in 911. The second is a community responder team. And then the third is a co-response model. So the models really differ in their screening rules and also the professionals on each team, but each allows a city to slightly divert a different array of calls or divert a slightly different array of calls. where traditional response is not appropriate. So I'll use the example of Durham, North Carolina to speak about these programs and how they work in practice, because I think it's easier to understand when it's grounded in a real world example. And I've had the pleasure of actually working with Durham's Holistic Empathetic Assistance Response Team, or HEART team, since 2021. And they operate one of the most robust and successful alternative response programs in the country. And they've now responded to over 40,000 calls since launch. So their first model is this like embedded clinician model, which they call their crisis call diversion team. So this is where they're placing a behavioral health clinician physically inside of 911 to speak directly to callers and provide them behavioral health support without having to send any in-person response. So an example of a call here could be a call where someone is feeling depressed and wants to be connected to resources, for example, and doesn't know where to go. They can sort of talk to a clinician in real time. The second team here that I'll highlight is the co-response team. So this is where you pair an armed law enforcement officer and a behavioral health clinician, and they respond together to calls that usually require some level of clinical expertise, but there's also a known safety risk. So there might be a weapon present or some violence on scene. And an example for this call that's very common is like a suicide attempt call, something where you need both the premise to be safe and secured, but also clinical expertise is really important. And then the last model here is their community responder team. So this one pairs a behavioral health professional, a peer support specialist, and an EMT in one team. And they respond to behavioral health and quality of life crises without a threat of violence or weapons on scene. The one thing I'll note, and my colleagues from LEAP will go into the details here, Durham's example has 3 members on their team. That differs depending on where you're at, what program you're looking at. But an example here that's very common is like this truancy call where a parent is having a hard time with a child, getting them to school. They call 911 because they're sort of at their wit's end and want some support. But there's really the need there is sort of like an underlying behavioral health need and not really like an enforcement need. And the last thing I'll say, just what rings true of all 3 models is that the work of each team is not enforcement centered. Instead, it's about de-escalation, really assessing what the needs of the caller are, stabilizing the situation, and doing some like really on the spot practical problem solving. So that might be like transporting someone somewhere, doing a referral to a community service, and really just like helping them deal with the crisis at hand.
Great, thank you, Gabriela. So it sounds like the community responder model is the newest and most cutting edge type of alternative response program that cities are testing right now. So let's dig into that model a bit more. Daut'e and Rebecca, what more can you tell us about community responder teams in the US?
Yeah, so after the unfortunate death of George Floyd, many cities started to consider how we can better respond to 911 calls. And out of that merged a lot of community responder programs. And Rebecca can go through our like timeline of how many programs actually started to come up. But that was kind of like the driving force of community responder programs. And what makes community responders programs so unique is that there's no law enforcement attached to these responders at all. These responders respond first to the call, and they have the ability to call for backup via 911 through the police dispatch if necessary, but they respond completely on their own. These responders oftentimes have lived experience. They have received lots of training in regards to conflict resolution, report writing, motivational interviewing, various different trainings that they receive in order to better respond to these calls. Community responder programs, in my opinion, really shape the start of how important it is to have the right responder responding to various different calls, because they're able to sit with callers more. I've heard stories about how, they're taking folks to McDonald's, or they've provided some type of physical resource such as a McDonald's card or a blanket, which they're able to carry in their vehicles. They're able to do transportations and provide, and this depends on on the city, but are able to provide the type of private care needed when someone is experiencing some type of mental health crises. And I think one of the best things about these programs is they aren't really pigeonholed. Like there's no just solely a mental health focus or mediation focus. A lot of these programs are having a broad range of focus where they can do a little bit more instead of just focusing solely on mental health calls. They're focused on doing conflict resolution as well, calls related to truancy, as Gabriela just mentioned. And I don't want to say it as if they're like this one problem solve type of team, because that's not who they are. They work well and woven into the original 911 response. But I do think that they have the capacity to handle a lot and are able to do so through various different trainings, as also by handling different calls. But I'll let Rebecca go into the map and she can talk a little bit more about community responder programs.
Yeah, I feel like Gabriela and Dee laid out a perfect foundation to go into the map, which was created to give city officials and others kind of the landscape of community responders across the country. Where are they? What calls are they responding to? Who are the responders, et cetera? And so we have kind of an overview. There is like the geographic component. Yeah, like where are all of these programs? But an important piece is how many calls are they responding to? And so we have all of these filters here to give people an idea to look at, if you're a city official or even just a concerned resident looking to advocate for a program like this, and you want to look at a comparable city, whether that's population wise, or you can look at different call categories, et cetera, that people are responding to. And I'll kind of give a tour of the map to give everyone this landscape of community responder programs. But we currently have 91 programs across the country in, I think it's around 88 cities. So some cities do have multiple programs that we count. And they're responding to, I think it's over 230,000 calls annually now. Yeah, so I think call volume is not the be all end all of measuring the outcomes of these programs, but it is something we want to highlight. So we have some high volume programs that we highlight here with these yellow diamonds versus the white circles. I'll show you what happens if you click on a program. You can see all the information that we do have for each program. If we don't know any of these, it doesn't display it. And then you can find out more by clicking on the website of a program and learning more about them. Go back here. And like I said, if you want to know, okay, I don't think any of these cities are comparable to mine. You want to just see like 1 million or above, and then you can go to table view and get a better idea and see, what's going on with them, call volume wise, budget wise, et cetera. Yes, so we have a bunch. I think Gabriela had mentioned some of the resources we have. I won't go into these, but I think we shared the link for the map, and then you can peruse, you can download the data directly and make your own charts and comparisons and see glossary of all the terms that we use and frequently asked questions to find out more. We have a bunch of resources from other organizations under national resources, which I would recommend people go check out to learn more. And then our dispatch and liability reports, which are also very useful. As Dee mentioned, I think, and actually Gabriela mentioned as well, these programs are new, but established. So we just want to highlight, I think you can see that there's not too many dots and then there's kind of an explosion at the end. But just to show that these programs are somewhat established, but 91 is a very new number. And we hope to keep seeing those dots keep popping up as we evolve this graphic as well. And then I think an important thing to highlight as well, we don't have the safety statistics for every single program that we can show on the map, but over all of those years that we show on the timeline and all of the hundreds of thousands of calls that these programs have been responding to over the years. There have been no responders killed or seriously injured on the job. And the vast majority of calls are handled entirely by community responders. I think about 2% referred to police, and about 1% of instances of responders feeling unsafe. And yeah, we just have a couple more specific instances from programs, just stats of their feelings of safety, low need for police backup, minimal police involvement, tried and tested models across a couple different cities here for the safety of both the responders and the people that they are responding to.
Todd, can I add something about these teams that I just want to
Please.
highlight or make sure that it doesn't get lost for the viewers or for the audience? Is the one thing that makes community responder teams like so special and unique compared to past iterations of diversion programs or other alternative response programs is that they are set up to be a true first responder, in that they can respond to 911 calls alone without support from police, fire, EMS, essentially, where in the past, when we've tried to sort of implement these types of alternative response teams, oftentimes the unarmed teams would need to wait for police to clear the scene or police to respond first, and then say, oh, this is a call that is not good for police, and now I'm going to call to send this to a different team. And this is like really shifting the way that you get access to these teams, and that you directly will get this team when you call a 911, like when you call with a 911 sort of like crisis, where you will get like connected with them directly instead of having to go through a police response first, which is just like the innovation of this type of program.
Great, thank you. Rebecca,
Yeah,
I
thanks
don't
for
know if
having
it's
me.
too late to go
Yeah.
back to the map, but I'm curious.
No, not at all.
Say a little bit more about the agencies that actually operate these programs. Like, where do they sit organizationally?
Yeah, perfect transition. I'll come back if we're interested into the responder types and stuff, but kind of combining the points of dispatch and operating agency. So about 40% of these programs are contracted to social services agencies, so 37 out of the 91 programs. And then the rest, about 60%, are in a pretty wide variety of city agencies, some also county agencies, depending. But I think most are city, so county here is like a pretty small sliver. Yeah. And I think, as Dee mentioned, very few programs, like no two programs are really alike. And so I think depending on the city, it's whatever fits them best. If it fits best for the relationships in the city, for what works best for them, funding wise, et cetera, to be in the fire department or a new community safety department or health department, et cetera. That's where they sit. Some are housed in police departments, fire departments, yeah, city or county, but we have about, yeah, I can't count, but a good number of variety within the city versus contracted. And then we went over a little bit the dispatch methods. The vast majority are 911 center led, so the call taker and dispatcher is the same person who would be dispatching police. And then embedded professional, separate professional sitting next to the police dispatcher, and then a sliver of external hotline led, where they would forward the call to an external hotline to dispatch the community responders. But these are all responding to 911 calls, as Gabriela mentioned.
Cool.
And then the last thing I'll show is just the responder types and the call categories. Both of these are our definitions, not using the program job titles for responder types or their CAD calls that they respond to. These are broader categories. So the responder types will be based on educational requirements. This is a graph of overall how many programs include a clinician or social worker or trained civilian EMT, et cetera. And then this is a rough Venn diagram of how many would include both an EMT and a trained civilian, et cetera, and then 3 out of 4, and et cetera. It's not a perfect system, but just to give a rough idea of the combinations. And then similarly for call categories, 81 programs generally responding to mental health calls, service connection, substance use, conflict resolution, et cetera. And we would say, in order to respond to as many calls as possible, having a wide variety of call types, and as Dee mentioned, valuing lived experience over necessarily having requirements for a licensed clinician on the team, or an advanced degree, to say. Yeah, and then the last thing we have here is just highlighting some programs that are responding to a lot of calls per resident, so not necessarily just flat out number of calls, but compared to the population. And how are they doing that? Part of that is having a wide variety of call categories and valuing lived experience and training on the job versus high educational requirements. I think this is just a description of this chart. And then we have a program highlight of Antioch, which has the highest of these calls per 1,000 residents. Yeah.
I just want to, I hate to beat a dead horse, but I really want to just highlight the importance of not pigeonholing programs to responding to a certain set of calls. Like when you only focus, let's say, on mental health or even service connection, there are oftentimes, and especially depending on the city, thousands to thousands of calls that will still get a police response if it is not carefully looked at and determined that it could be handled by a community responder. And then you get into a bunch of questions like, well, what is the point of community responders if they're not going to handle this, or they're only handling a small amount of calls? So I really, really would continue to emphasize just making these programs more broad and not pigeonholing them to a certain call type, because again, then there are thousands of calls that are still going to receive a police response, and they may not necessarily need to.
Great, thank you. I love this map, by the way. I was exploring it over the weekend, and there's just a ton of information on it right now about community response programs across the country, and which makes me ask, where can viewers go to learn more about some of the other types of alternative response programs, as well as programs that operate outside of the U.S.?
Yeah, we have a couple other, I think we'll include some links in the chat or this webinar, but we have a couple other linked in our national resources document. And yeah, there's other databases and maps that include more than just community responder programs. And we only include programs that respond to 911 calls. So there's definitely more extensive lists that include programs that respond to other numbers and their own hotlines. And I will also say, if we've missed any programs, or you have updated information on a program, we have a link here under Let Us Know that we would love to get updated information or missing information, inaccurate information. We'd love to hear from you on that as well.
Cool, thanks. All right, we've had several more questions come in from the audience. First, Gabriela, this is a question from Melody. What are your thoughts about the trend of CIT officers?
Yeah. So
Maybe explain what CIT officers are first. Yeah.
Yes. So CIT training is, I believe the acronym is Crisis Intervention Training. And it is a very popular training program that officers will go through across the United States. I'm not super expert in the program, but I can speak a little bit about it. I believe it's about a 40-hour training class that CIT officers will take. And I will say, we, at least at the GPL, we are supportive of the CIT training of the officers and anything that will help prepare officers to deal with the very vast differences of calls of what they might show up to on a 911 call. So as far as should we be training officers to know how to deal with crisis and intervene in a way that is the least harmful and can be supportive, that is yes. But I think this gets at a larger question of like the right response at the right time for the types of calls that there is no enforcement needed or any necessity of an armed response. So they kind of, I would argue that they get at different types of challenges in the first response system.
Great, thanks. And I have another question from the audience. This one's from Preston for Rebecca. Are you seeing more 911 centers adopting a behavioral health response protocol as opposed to sort of traditional run type codes?
I think for community responder programs, because they are responding to calls that used to be going to police, they are not overhauling the dispatch protocol, if that is what the question is getting at. And as we went through the dispatch method, most of these programs are using the same dispatchers as police. So they will have usually their own protocol for which calls are eligible for the community responder program. I'm not sure if that answers the question.
Okay. Preston, if it didn't, please drop another related question in the chat and follow up. I have a question for Daut'e from Dew. The question is, who provides training for these types of responders? There isn't something like an obvious fire or police academy.
Right. That's a really great question. I think many cities, or I know many cities, are relying on local partners to do these trainings, especially when you think about the cost. Like, who wants to pay somebody all the way in California? You may be in New York, right? And I think what they're really relying on is the people who, again, are already doing the work within the community. So, for example, when it comes to learning how to work the radio and scene safety training, they're relying on their local sheriff's office or police departments to provide that training. Many organizations are doing work in regards to mediation and conflict resolution. So they then create a partnership with them and they come in and provide training. I'm pretty much emphasizing that many programs are relying on local partnerships to provide the training, and then the cities and the partners, they hash out the details about how this can be done, whether it's going to be paid for and how much. But again, many cities are just relying on the people who are already doing similar work to provide the training to community responders, in which the program directors are the ones who then are responsible for putting together the training curriculum and making sure that the training happens.
Great, thanks. Okay, so far we've talked about the context and motivation underlying alternative first response programs in this country, and we've learned a lot about how they work in practice. Let's turn our attention now to how well they work in practice. And Gabriela, what do we know about how well these programs work? What's the evidence of their impact?
Yes, that's a great question. So I think the way that I think about that question is in a few different ways. So there's really like three main questions of like, how are these programs working that we're seeking to answer right now in the field? So the first is, can these teams work within the 911 emergency response system? So like literally, can they respond to 911 calls safely is one question of how they work. The second would be about whether the teams can reduce unnecessary interactions with the criminal justice system for the folks that they're responding to. And then the third is around, can these programs really improve longer term individual level outcomes for people? So for the first one, I'll say that we are seeing some evidence that they work, some pretty strong evidence. So my team has actually published a report recently looking into this question of whether these teams can operate as first responders within the 911 system. And so we looked at program data from 9 community responder teams across the United States to look at how those programs were operating across cities and really get an early indication of their performance. And one finding that was really exciting for us to see was that these teams are responding to 911 calls alone, how we expect them to. So one things that folks were keeping an eye out on was like, are we sending these teams, these unarmed teams as first responders, and they're inevitably going to call police because they're not well fit or they're going to like need support in some way. So we're just prolonging like an eventual police response essentially. And what we found is that that is not happening. So when the responders are sent as the first and only responders, they actually rarely call for police on scene for police support. And we saw that it only happened on about 2% of calls. So we're feeling pretty confident that that's an indication that the types of incidents that we're dispatching to community responder teams are actually safe and appropriate for an unarmed response. And then the second question about what is the impact on criminal justice system outcomes? I think there, yes, we're also seeing some pretty positive up and coming findings in a few good causal studies that have been published. So that those studies have shown that the community responder teams can reduce low levels of crime reported and also reduce arrests. And then there's also some evidence that co-response models have reduced the use of involuntary psychiatric hold. So again, this unnecessary involvement with the criminal justice system, we're starting to see some of that. But I will say that the last question on the longer term impacts is where there's the biggest gap in the research. So things that we would care about in that bucket would be understanding whether an interaction with a community responder team or an alternative response team is actually like making you healthier, like you're seeing healthier outcomes, you're being connected to services that maybe keep you away from the crisis system for a more prolonged time, like 5-10+ years in advance. Like those are the types of questions that we're really interested in, not just whether they're avoiding criminal justice system contact at the point of the call, but just like what are the longer term impacts. So I think my honest answer to this question would probably be something around the evidence is promising, but it's still very much developing.
Great, thank you. All right, Daut'e, I'm wondering, we've heard that it sounds like the evidence is positive so far, right? It looks like these programs are doing good in the communities in which they operate. But I'm wondering, are there any drawbacks or concerns about these programs?
I think with anything new, there's always concerns or potential drawbacks. And I feel like I'm going to answer this in a way that provides the concern, but also the answer to how to legitimize these concerns, or illegitimize these concerns. I think for one, no matter who we're talking to, whether it's a city mayor or the police chief, people want to know if these responders are going to be safe. And as Rebecca has mentioned earlier, from what we've collected, no one has been harmed or seriously injured or killed while doing this community responder work. But that doesn't, shake away people's concerns or fear that much. And I think one of the things that truly helps that concern is that connection and relationship with dispatch and your police department. This work seriously cannot be done without them. You want to have a great relationship with your dispatch and your police to if there's something that happens where they need police for an emergency, they're able to call them. Before a call is even sent, dispatch are asking good questions and ruling out potential disqualifiers like violence, weapons, even orders of protection. All of those things are important. So you really want to have a great relationship to really ease people's concerns about safety. I think, on the community side, people are concerned whether these programs will actually provide social outcomes. I think, many cities are dealing with budget deficits and struggling to provide quality services. And so, and this is my own personal like beef with these programs, is it makes no sense to have these responders and say, oh, we're going to make sure that they're able to have good resource navigation and provide people to good resources if the good resources don't exist. So community members really are looking at these programs critically, saying, okay, they can clearly respond to the calls, but can we provide the quality services needed to really hone in on prevention and reducing these type of calls to 911? I would say another, drawback or concern is just about from the police side, whether these programs are working. And as Gabriela has mentioned, many of these that they only call for police response about 2% of the time after they have already responded to these calls. And I think we've gone a little bit more deeper in saying that, like, are they calling police because they're fearing for their safety and they need police backup emergency wise? Or are they calling for police because whatever is needed initially is not something that community responders can do? Because again, they do not assume the role of law enforcement whatsoever. They can't file reports in regards to policing work. They can't arrest people. So I think that alone right there has one, it's a concern for law enforcement, but through the data we've been able to show that like no one is assuming your role, but they also are able to respond to these calls in a safe manner and call you when necessary. I think those are like probably my top three concerns that I see or drawbacks coming out of these programs, but I'm sure depending on who you are talking to, there might be more.
Yeah, I think it definitely depends on who you ask. Another similar to safety, another one that comes up is liability. If you're increasing a city's liability by dispatching non-law enforcement to these calls, but I'll plug LEAP's liability report here. I think we can put the link or it's linked on the map. You can go through there. But yeah, you're not increasing the city's liability by sending these responders, which I think is important to highlight. Maybe not the average citizen's concern, but definitely cities. And then funding, I think we could have a whole separate webinar on funding and community responders. But Todd, I know you're the health economist, so I'd love to hear your perspective on the cost of these programs.
Sure, thanks for asking. And actually that ties in very nicely with the question from Eric, who asked, these programs sound great in terms of sharing the burden with EMS and other first responding agencies. How would the community response team stay sustainable, either financially or in terms of staffing? Well, okay, so in my opinion, it depends on whose perspective you take, right? The answer is going to depend on who you ask, like Rebecca said. So from the perspective of society, I think these programs are clearly worth it. Right? If we could add up all the benefits to all the beneficiaries of alternative response programs, including the callers and their families and friends and caregivers, the healthcare system, health insurance companies, the criminal legal system, the rest of the first responder ecosystem like police, fire, EMS, if we could add up all of the benefits to all of these stakeholder groups, I think they would swamp the program operating costs. There's no question in my mind. So that's an easy one to answer. But it's not obvious to me that these programs are worth it from the perspective of the organizations that actually fund the programs. To be blunt, the majority of the benefits of these programs don't go to the organizations that pay for them. And so what we find is that the majority of alternative response programs today face a precarious existence, right? They're living year to year at the mercy of annual budget cycles, despite the fact that they are, again, in my opinion, very clearly worth it from society's perspective. So I think one of the most important questions for the field today is how can alternative response programs achieve long-term financial sustainability? And I think a good place to start answering that question is with a detailed accounting of which stakeholder groups win, lose, and by how much across a wide variety of program models and funding types. Yeah, so that's my long answer to the question. Sorry to step in as a host, but yeah, those are my thoughts on that. Okay, so I don't see any more questions in the audience, but please, if you have any more, drop them in the chat. So barring no more questions, to wrap up our conversation, I have a final question for all of our panelists. What advice can you give members of the audience who would like to start an alt response program in their own community? And let's start with you first, Daut'e, and then go to Rebecca, and we'll conclude with Gabriela.
Yeah, I would say making sure that you consider all your stakeholders before diving into trying to do a community responder program. You want to talk to literally everybody, and I know that probably sounds cliche as you consider this work, but truly you want to get the perspective of your law enforcement, your community, your mayor. I think having those honest conversations up front before diving into the work really eases some some of the concerns when doing or at least planning community responder programs. It also puts everyone on the right stage and building those relationships early so that when the program is actually implemented, you know, everyone is working together in a fine copacetic way instead of trying to wait until you've already planned the program and ready to implement and then pulling people in, because folks are going to be asking, well, why didn't you bring us in sooner? So I think that is one advice that I would give to anybody trying to start a community responder program or really any alternative response program.
Yeah, I would say see if there's already movement in that direction. If it's happening in your city already, if there's already community members working toward that. If not, see if a nearby city on our map has a program. If you could ask them for advice on what they did, maybe not a nearby city, maybe a comparable city of a similar size, type, etc. And see if you could ask them for advice on what they did. And then I'll also plug that our national resources document has a bunch of toolkits from other organizations that have way more than we can list off on this call right now that I would point people to. I think we have a whole handful on there.
And I'll give 2 quick hits of advice. So we've been implementing these teams now for about 5 years, and the 2 places where I see programs really make mistakes in their implementation are not being very clear about their goals or their vision. So I think you need to start by being very, very specific about what calls you want to handle differently, and not being vague about like, oh, I want to do behavioral health generally, or like some like very big like sweeped like big sweep sort of visions for your program, and instead like get in the weeds of like, I want to handle mental health calls where there's a risk of violence, and then match the types of calls that you want to handle and your goals to the appropriate alternative response model. So I think one thing that people get tripped up on when thinking about these teams is that they have vague goals and then they attach the team that they think is the best, and there's just like a mismatch on like the types of teams that the different responders are best set to go out on. So I would just like make sure that what you're saying you're going to go on, you're matching with the team that you want to implement, so that you get those outcomes. And then the last thing I'll say is, don't forget about 911 and your emergency communication system when you're planning these teams. I think a lot of times they're an afterthought of like, oh, this is what we want to do now, just triage the calls for us. And they should really be central to your planning process. From my experience, they're the ones that are most heavily impacted by the changes and the workflows. So please don't forget about them. I can like every time and time again when governments come to us asking us for help, we always ask like, do you have buy-in from 911? And the folks that are struggling, it's oftentimes because they do not have buy-in from 911. So just make sure that they're involved from the get-go.
Great, thanks. That's awesome advice from all 3 of you. So before we wrap up, we actually have 2 more questions from the audience that came in while y'all were speaking. So the first question is from Anne, and she asks, is there a role for community responders? What do you think?
And this is like volunteers.
Oh, what did I say?
Right?
I said, no, I said it wrong. Is there a role for community volunteers in community response programs? Thank you. Thank you, Gabriela.
I will say that these are extremely like professionalized roles that go through a lot of extensive training and need to be like hired and sort of picked and trained carefully. And in the same way that we wouldn't want, at least me personally, I wouldn't want like a volunteer police officer showing up at like my time of like crisis. I would want like a very like big professional, like a well-trained professional showing up in my times of crisis in those situations. But I will say that there's always a role for community volunteers. Like a lot of these teams are they're running drives, for example, for things that they can give out on scene. So like clothing or personal care items or blankets, things like that. or helping spread the word. So I think a lot of the jurisdictions that also we've seen are most successful is that the community is quite involved with advocating for the program, making sure that city council knows that it's important for them and that they are expecting to see the program grow and expand and have more hours and more coverage. In that sense, I think community volunteers and organizing has been incredibly indispensable. So if you have a little bit extra time and you want to volunteer for these programs, that is where I would target your efforts.
Great, thank you. Last question for now is a question for Rebecca from Melody. Do you think connecting with the state's 988 program would be a good idea?
Yeah, I think at the start when Gabriela laid out the Landscape of Durham's program, where they have all three of these kind of alternative response models, is very helpful, because a lot of these cities that we have on our map, for example, they have more than just a community responder program. And to connect it to the volunteer question, they are far from the only alternative response or similar resource like this. Like, they're always relying on community partners and stuff like this. And similarly, plenty of these places take calls from 988 or have robust 988 programs that are at least affiliated with the program or something like that. So in our FAQ, we have a little bit more of a breakdown on what's the difference between these programs responding to 911 and 988 calls. I think in a lot of places, a lot of 988 calls don't get an in-person response, but much like when LEAP goes through 911 call narratives and is like, okay, which of these calls could receive a community response? I'm sure there are some 988 calls that could receive an in-person response. And in these places that have successful community responder programs that are going to 911 calls that are related to mental health and 988 programs, I'm sure they're collaborating a lot and have 988 calls that are forwarded to 911 and get an in-person response. So I think having a healthy relationship between the two is definitely very important. And there are plenty of these programs that also respond to some 988 calls.
But the one thing I would flag is that from my experience, it shouldn't be the only place that you're getting calls from. It should be an additional location to pull calls from that are eligible if you want to work with them. But if you want to maximize your call volume, we've seen just time and time again that 911 is sort of where you're going to see a lot of your call volume.
Good point. Thank you.
Great, thanks. Well, seeing no additional questions from the audience, that wraps it up for today's webinar. Daut'e, Rebecca, and Gabriela, thank you so much for sharing your expertise with us. And thanks everyone watching for your questions and your engagement. Have a good afternoon.
Thanks.